And now to give more insight on the welfare of nurses, we're joined by Chairman, National Association of Nigerian Nurses and Midwives, Lagos Chapter, Christianah Adeboboye. She joins me live here in the studio. Mrs. Adeboboye, thanks so much for joining us.
You're most welcome.
I mean, what are the specific concessions or commitments that have been made by the government that led to the calling off of this strike?
Thank you so very much. I think we need to commend the federal government of Nigeria for taking it upon themselves to actually start up dialogue, at least discussion, and making plans out how to meet these demands in a certain frame of time. So I think it's commendable for them to have come on board and agree that, okay, there is need to look into these demands and provide solutions in a space of time, depending on the particular demand that it is.
Right. Again, the specifics of the concessions and the commitments that the government made.
Okay. Let me start with the first demand, which is the gazetting of the nurses scheme of service. It has been approved since 2016 in Minna State, and up to now yet to be implemented or yet to be gazetted. And so within a space of 4 weeks, we are looking at 4 weeks from now, I think from the day of call-off of the strike till the end of that 4 weeks. And it depends, and like the other one that has to do with the implementation of the National Industrial Court judgment and creation of Department of Nursing at the Federal Ministry of Health, where they have charged the necessary bodies to look into it and quickly give them possible solution and make it happen. Also, looking at the upward review of nurses' allowances, the upward review is something they are going to sit down with the necessary ministries that will work on it, and then sit with each union, because there are specific allowances based on professions. So each health professionals will have that, and specialists as well. Then looking at decentralization of internship program for graduate nurses, this will definitely happen as soon as possible, because the Nursing and Midwifery Council of Nigeria has been mandated to quickly complete the process, because the process is ongoing. They should complete the process and make it a central means of, assessing internship placement for our graduate nurses. And then looking at ensuring that NANNM is well represented in all the boards, the Federal Health Institution Board. That is something that is, is an immediate thing that can quickly come on board, because to be candid, we are not fairly represented. So we need to be well represented in different boards as necessary as possible.
Yeah, there's one thing for agreements and concessions and commitments to be made. Another is to make sure that they follow through. And if there's one thing that's clear, the government makes a lot of promises, and we see reprisal of strikes happen because they were not able to fulfill those promises. Yes. Did your body have any legally binding documents to make sure that they follow through, especially with the gazetting, or was it just verbal, concessions?
Right. I'm sure it wasn't a verbal concession or agreement. There was an MOU that was drafted and signed at the end of the dialogue and the engagement also. So it means it has been, we are binding, as in the government has been, guided by that. And then we also have the leadership of NANNM, the national NANNM, to track the process and to ensure that at due time all these promises are made and are fulfilled.
So they are the monitoring mechanism that you have put in place to establish
yes.
But what if they breach this? What if it doesn't fall through? Would there be
simple?
What would the escalation strategies?
That is very simple. We didn't say the strike has ended. We suspended the strike, awaiting the implementation as promised. So failure to meet up with this may also means that the strike will continue.
Right. And if the strike continues, what's the duration you're looking at? If it continues and they come back again and it's another promise and fail?
We do not pray that the strike should continue, and we also do not pray that the government should not fulfill their own part. We pray that they should fulfill their part. However, if promises are not made, promises made are not fulfilled, we have our own ways of
Right.
taking care of it.
Right. Your association has gone on the 7-day strike. There's now been a verbal, or rather a legal binding from with the government.
MOU,
You know, what would a utopia? I don't want to use the word utopian, but what would be the perfect conditions for nurses? Because we know that the healthcare sector has been hit with the mass, you know, exodus, the japa, you know, everything that's affected your sector. So what would it look like if all of this is put through? What about the conditions of nurses? What's a perfect condition given all this situation for nurses in Nigeria?
Well, let me say that for everyone that is set up to work, you expect that you get the best remuneration that can be commensurate with the work you do. However, in our own setting, we know that inflation is you know, skyrocketing every day. Things are not the same, and we cannot expect that the same amount of money that we have been paid or allowances that we received 5 years or 10 years back, we should continue with that.
Right.
That will not make sense with the present economy. So the present economic situation, of course, will enhance us, or will determine the next, you know, line of action. And of course, there should be a regular review of these allowances, and that is why, because it has not been, and that is why we are stuck to this point.
Right. I mean, I must say thank you for taking out the time to join us.
Thank you so much.
Christianah Adeboboye, she's the chairman, National Association of Nigerian Nurses and Midwives, Lagos Chapter.